Learning Outcomes of Short-Term Global Health Electives by Christina Doctor of Michigan State University. This presentation is a result of a research study of medical service study abroad courses that took place from 2008 to 2012 in Guatemala and Peru. I'm going to discuss the 7 core competencies as learning outcomes. These are the core competencies that all medical students need to learn and achieve. Patient care, professionalism, practice-based learning, systems-based practice, communication and interpersonal skills, and medical knowledge and osteopathic principles and manipulation. The last competency is akin to osteopathic medical schools. First, medical knowledge. Students must demonstrate understanding of established and evolving medical knowledge. In medical service missions, the doctor-student ratio is low, and so the students have many opportunities to learn and get hands-on experience. Many students report that they teach other students who have not taken this course when they enroll in other courses such as clinicals. Even before the trip, students practice medical knowledge because they have to pack lots of medications. So they have a lot of exposure to pharmaceuticals. Another core competency is communication and interpersonal skills. Students must demonstrate communication skills in their ability to team with patients, the patient's families, and professional associates. So in these medical health electives, because there's often a language barrier, students become keenly aware of body language, gestures, and patients' physical demeanor. Developing these sensitivities are forced on them. Also, because they are in a foreign environment, communication in teams is crucial in order for them to be successful. Another core competency is systems-based practice. Students must begin to demonstrate an awareness of and responsiveness to the larger context and the ability to effectively call on systems resources. Students see the destitute and the plight of the less fortunate. They understand how poverty affects the medical system as they watch long lines of people waiting for hours just to get their service. And they must carry out assignments and come prepared. In a lot of cases, they need to learn before they come and provide patient care. And of course, before the trip, students are prepared with practice and preceptorship, and they learn about tropical medicine. Perhaps the most important competency is professionalism. Students must demonstrate a commitment to carrying out professional responsibilities and ethical principles, and become sensitive to a diverse patient population. And of course, on this service mission trips, they have plenty of opportunities to do this. And they become sensitive to others' behavior and become judgmental of them. And they often question their own ethical behavior. Often they question their own motives for being on this trip. And they mingle with the locals. So they have plenty of opportunities to learn across differences. For patient care, students must demonstrate the ability to effectively treat patients. They're expected to demonstrate the ability to obtain a medical history, perform a complete physical exam, and demonstrate the ability to collect accurate history and physicals and keep accurate records. And they have plenty of opportunity to do that. And then lastly, they must demonstrate the application of osteopathic principles, and that includes osteopathic manipulative treatment, which students have plenty of opportunities to do. So all of the core competencies are covered during this